likelihood that a supplement is going to reverse and restore a person's genetic hair loss, like with female pattern baldness or male pattern baldness, is pretty much zero. I want you to know you do have options. I want you to be careful with what you're choosing to take. Nothing that I've mentioned is free of side effects. There is light at the end of the tunnel to have your life back. So I have had hair loss for nearly 25 years, starting when I was 21 years old in 1999. Now, my type of hair loss, I have two types, is androgenetic alopecia, female pattern baldness. And then in 2022, I got a second type of hair loss. I didn't know you could get two, but I also got an inflammatory alopecia. But I get contacted a lot by women that they just don't know where to begin, what to do when they start losing their hair. It's scary, it's confusing, and while there is a lot of information now online, it's still confusing and it's still terrifying. So I will say that not everybody feels like they have to have a diagnosis to move forward in their journey, but I think to me, having a diagnosis was important for me for a number of reasons. One, on the treatment front, if you're going to be treating your hair loss, you need to know what you are treating. And also, in my case, it helped, even though it hurt, to know that it was female pattern baldness, it was progressive, this was lifelong. It was a hard pill to swallow, and it did take me a long time to swallow it, but that also allowed me to move forward eventually, knowing that that was the case and not holding on to the hope that my hair loss would spontaneously reverse. And some hair losses can actually spontaneously reverse. That is a thing. That is the thing with alopecia areata, universalis, totalis. Those are actually types of hair loss that can actually spontaneously reverse. And in some people, they may never do that, but the possibility exists. With genetic hair loss, that possibility does not exist. This is a progressive disorder for men and women, and the hair will miniaturize over time and it get thinner and thinner and thinner and thinner. So the choices are to do nothing, to treat it with real treatments that are available, cosmetic solutions like fibers or like a wig like I'm wearing. And the right thing to do will vary from person to person, and it doesn't have to be just one thing. Like, there is nothing wrong with choosing to treat your hair loss and choosing to wear wigs. I did that for many, many years. I did treat my hair loss with a number of things fairly early on. Rogaine, Aldactone, 200 milligrams. They put me back on the birth control pill, which actually kicked in my genetic predisposition for female pattern baldness, so that I definitely regret. I was on Propecia and Minoxidil, which I'm sure did nothing. And eventually in 2009, I started doing PRP, which is what I felt eventually was the only way I wanted to treat my hair loss. I no longer wanted to systemically treat it. There's a lot of psychological reasons that went into that, because for me, I treated my hair loss what I consider to be too early. And some people may say early intervention is key, and there is certainly validity to that. But in my case, I think I wish I gave myself a little bit more time. I think I wish I gave myself a little bit more time to see how my body would have responded on its own after getting off the pill, rather than panicking, running out the door and buying everything that I could and trying to, ingest everything I could on the planet. I feel like I don't know if I did, but I feel like I possibly made things worse. And in doing that, I got hooked up onto taking basically the birth control pill again and being stuck on it, because knowing that getting off of it could create a shed, I didn't want to endure that. And also the same with Aldactone. I was stuck on it because I knew that if I got off of it, it could create a shed. So I lived on these medications not knowing if they were helping me at all, and just hating that I was taking them. I took them for 13 years, like against my will, basically, because if I had a do-over, I wouldn't have done it the same way. That's not to say that people don't find benefit in treatment. It's just that I don't like the way that I went about treating my own hair loss. I didn't consider how I would feel, not just present day, but treating my hair loss like 10 years from now. When you're in the moment, you're willing to do anything and everything, and you don't really think about 5 years or 10 years. And what if you want to have a baby? You're going to have to get off these medications. And are you willing to do that and sustain the shed that will occur when you get off the medication? Maybe yes, maybe no. For a lot of people, there is a huge psychological component to this. And for me, I felt stuck and I felt trapped, and it was it added to the pain of my loss because my hair loss continued to progress the entire time this was happening. So it wasn't like I got a reprieve, it wasn't like it's slowing it down, so at least I'm getting that. It just continued to fall out, but now I was stuck on these medications. When you do treatment, you have to know what that entails. Treatments for hair loss, and like some people don't know this, but if you're treating genetic hair loss, female pattern hair loss, male pattern hair loss, this is a treatment that will have to be lifelong if you want to continue to get any of the benefits received, if any are received. It can create a shed going on. It can create a shed coming off, including the loss of any benefits that you got from the medication. Anything that has the possibility to actually legitimately provide you the possibility of reducing the shedding, the possibility of regrowth, also has the possibility of creating further hair loss. And on the topic of treatments, I know so many people want to just believe in anything and everything that they see, like whatever it is. I get so many questions on X, Y, Z, like the amount of true treatments that have the actual ability to make a difference in female pattern baldness are limited. And for some people, they try everything and they don't see any benefits. And for others, they see some benefits from some things, but not other things. You have to read everything. Oftentimes, the answer to whether or not that has any ability to work on your head is right in the text of what you're reading. Like the wording is often a little fuzzy, can promote stronger hair, can promote stronger hair on the hair already growing out of your head. Like it's all this like gibbery goop of letting you know that you're going to take some vitamins that maybe will help your hair look a little bit better. And there's nothing wrong with that, but you have to know what you're signing up for. Not everybody does. They're pinning all their hopes and dreams on these medications and they don't actually have the ability to do anything. So, of course, this will also depend on your type of hair loss, I suppose. If you're extremely vitamin deficient, in something, then taking vitamins can help. If you're extremely stressed, there is definitely a place for massively stress-induced hair loss. That is actually a thing. It can kick in also an autoimmune type of hair loss, which was certainly the case for me in 2022. So there are things that you can take to lower stress and help to improve the situation overall. And there's nothing wrong with that. But I just think that there are a lot of things that are touted as being these treatments and can get all your hair back in 3 to 6 months. And it's not really the way that it works, unfortunately. And there's nothing wrong, by the way, with trying what you want to take, whatever it is that you want to do, but just also know that there are sometimes risks associated with those things as well. Some of these things have saw palmetto in them. That's not an innocuous thing. Saw palmetto can absolutely affect a positive or a negative response on your hair follicle. It can create a shed as well. It can affect your hormones. It can affect your hair. The medications that are typically used are going to be Rogaine, Minoxidil, Topical, 5% usually. You do have the 2%, but that's rarely prescribed nowadays. It wasn't even like early 2000s, they told me just to get the men's. Oral Minoxidil seems to be helping both men and women to a decent degree, more than the other stuff, I would say. And had this been presented to me when I was in the treatment mode in the early 2000s, I would have definitely have taken it. It has been presented to me 3 times in the last couple of years, and I have declined each time. I no longer want to systemically treat my hair loss, but I would have definitely taken it. And I do have friends that are on oral minoxidil and doing well with that medication, with the results that they are seeing. So you have topical oral minoxidil, you have Propecia, Finasteride, which is a drug typically just for men. You got to be careful about that. If you are of childbearing years, you do not want to get pregnant on this medication. It can be extremely damaging to the fetus. So there's like massive warnings against that. They typically will usually prescribe it to women that are postmenopausal, but they will also prescribe it to women like they did to me in my early 20s if you're like willing to take a birth control pill, which they put me back on to treat my hair loss, and willing to take precautions and knowing like you cannot have a baby while on that medication. Spirolactone, which is, the brand name is Aldactone, which is what I took. I took 200 milligrams of that because I was told the only dosage that would actually be effective on the hair was 200 milligrams. It has anti-androgenic properties, even though it's a high blood pressure pill. I believe also Lonitine, which is minoxidil, is a high blood pressure thing as well, interestingly enough. And then there's what I basically stuck with for 14 years, which was platelet-rich plasma therapy. There are mixed opinions about this. Some people don't believe it has any merit I did it for 14 years, flying from Los Angeles to Florida to have this done every 4 to 5 months. So my vote on whether or not I believe this has merit is very clear. But I also think who you see matters in this treatment. I don't think all PRP is created equal. I don't think that everybody's doing it the same. I think it's a cash cow. I think Medispas throw it on their menu of things so that they can just take people's money. There was a portion of the population that got PRP that never even saw somebody that was doing it to the standards that it would actually affect change. And they got no results. They did PRP, they know it didn't work, but they don't know if it would have worked had they gone to someone that was doing it correctly. But then there's also the possibility that you go to someone that is doing PRP exactly as it should be done, and you get no results anyways. And the reason why is because none of these treatments will work across the board for every single person. Some people will find benefit in one and not another, and some people find no benefit in anything. And then there's the expectation level, having realistic expectations when you are doing treatments, because none of these treatments are going to restore you back to the way that you were before your hair loss began. And that's also a hard pill to swallow. But there is merit to it and there's validity to it in the, what is it called? My God, what is it called? In slowing the progression of hair loss. If you can slow the progression, you get to have your hair longer. So there is benefit to that. Of course, there's benefit to slowing the progression of hair loss. That itself is a big thing. It's the main thing and the main reason why I did PRP was to slow the progression, to keep as much of my head on my head as possible. But I always point out to people, I started PRP in 2009 and I started wearing wigs in 2012. So PRP was never going to give me what wigs could give me. And I still wanted to maintain my hair on my head as much as I could, slow the progression, do what I could in a way that I felt comfortable. And that was the way that I felt comfortable. I know that some people just think all treatments are useless, just buy a wig and call it a day. But wigs, and I will take mine off, but wigs are not for everybody. They just aren't. Neither is shaving your head. We have to find a way to make this work. And how this works for us may look different than somebody else. And somebody else may not understand the way that you want to do things. I think treating your hair loss is absolutely okay. Of course, you got to know what you are treating. So having a diagnosis is important. And it's important to have realistic expectations. And it's important to be honest with yourself about what is out there, as far as not falling into the trap of believing the ridiculousness of what sometimes is being touted as some kind of miracle. There is no miracle to female pattern baldness. There just is none. I mainly am speaking about female pattern baldness, even though I also have an inflammatory alopecia, because that is what I have had since 1999. But there are treatments for alopecia areata, like Olumiant or Citinib, I think it's called. There are treatments for that as well. So you have to know, and there are side effects to everything. Everything has a side effect. Nothing that I've mentioned is free of side effects. Not even PRP, where they're taking your own blood and, using it in your head. The possibility still exists with PRP that you could have more hair loss. There are a few women that have contacted me over the years that believe PRP made their hair loss worse. And it just was not redeemable. Like, it made it worse, period. They never went back, and it's just worse. That was not my experience. I didn't experience increased shedding from it. I experienced positive results. The results that I saw were the slowing of the shedding. I saw the hair quality initially was improved, like the color, the pigment, the thickness, and I felt it just looked fuller. There probably was a little bit of regrowth as well. And starting to do that at that point in time really helped me to maintain a good deal of my hair that I was using to blend with my wigs that I started wearing in 2012. And I used my wigs and my own hair in my life like together. I never wore my wigs 24/7 from morning to night. I, wore my wigs where they work for me, and I used my bio hair where it worked for me, just like I am doing now with a shaved head. It's just now it's shaved. Sometimes with wigs, people think that you have to live in them 24/7. How am I going to go to the beach? How am I going to go to the gym? How am I going to do this? Nothing has to be all or none. It can be, I'm wearing my wig to, X, Y, and Z, because that's where it's going to be best. And then when I'm doing the pool and exercising, I'm wearing either nothing, putting my hair in a ponytail, or I'm wearing a beanie or whatever. Some people do work out in their wigs, and some people do swim in their wigs, and some people do go to the beach in their wigs. But I never found the comfort level in that. I found comfort level in basically existing as I was with my bio hair, and then having my wig life. And eventually also everybody in my life knew me both ways. So that's how I've lived my life for almost the entirety of the time that I've worn wigs. I definitely started telling people fairly early on in my wig life. And not everybody right away, but eventually within a couple of years, definitely everybody knew. And I was very outward about it as far as being able to take it off in front of people and just, like I said, present myself both ways, getting comfortable in that. That's exactly what I still do with this situation you see before you here. I wanted to talk about the medications. I wanted to talk about the treatments. I wanted to talk about the importance of getting a diagnosis because it's confusing. Hair loss is scary and we don't know, what to do or where to start. Starting point is actually getting a diagnosis and knowing what you're up against. And regardless of what that diagnosis is, and also no, not all hair loss is actually permanent. There are temporary forms of hair loss that is actually a thing. And I'm not just saying that. Some people do have hair loss situations that are temporary. With a diagnosis, you would find that out either through dermoscopy, where they put something to your head to look at the follicle, or through a biopsy done appropriately, properly, from somebody trained to do it properly, meaning taking it from the correct area of the head. It has to be taken from the correct spot. It has to be read by someone that knows what they're doing. Otherwise, it can give you a false result, inconclusive, and it can be inconclusive anyways. But there are a number of ways, a couple there, to get a diagnosis. And from that, you can determine if you want to treat it. And from all of that, I still want to say this. It is difficult to learn to live with hair loss. It is difficult to learn to let go of a part of yourself. Like, that's done. Like, I can never be exactly who I was before I started losing my hair in that same way. I've had to evolve, adapt. I've suffered through a lot of things. I've lost a huge part of myself for many years, and then struggling to get it back, and then losing it, and then frustrated that this was my reality. It has not been this smooth sailing journey. For anybody at the beginning of it, I just do want to say that there is light at the end of the tunnel. Whether or not your diagnosis determines that this is going to be lifelong. If you do have a diagnosis that is telling you that this will be something you will be dealing with forever, it's not just me. There are so many other women out there that have learned to make this work in their life in different ways. It's hard to explain, but you just kind of start to adapt to a new normal. It's not what I would have chosen for myself, that's for sure. Does it feel unfair at times? I'm sure it has, but you can still have a good life. You can have all of your life. You can be happy. You can laugh. You can not be withdrawn and depressed if that's a place that you feel that you're in, and many women are in that place. There is light at the end of the tunnel to have your life back. That is truly a thing. I'm not just saying that to make anybody feel better. It's because I've lived it, and I've had to live not getting not one type of hair loss, but two. And that has not been easy. Adjusting again, finding one way to live your life, and then having that ripped out from under you, and then having to find a whole other way to live your hair loss wig life, wearing different types of wigs, trying to make this whole thing work in a different way. That was not easy. That was not something I could see coming from a mile away. I did not anticipate that. I thought I would be dead and buried before the amount of loss that occurred, because that's simply not how female pattern baldness progresses in the way that an inflammatory alopecia can. So I don't know if this was helpful to anybody, but I want people to know that I understand. I want you to know you do have options. I want you to be careful with what you're choosing to take, what you are spending your money on. Do not fall for false promises. If it sounds too good to be true, it probably is. I don't have anything against taking vitamins or whatever supplements you want to take, but the likelihood that a supplement is going to reverse and restore a person's genetic hair loss, like with female pattern baldness or male pattern baldness, is pretty much zero. I'm not a doctor. I don't have to be a doctor to tell anybody that. That is just the reality. Doesn't mean it won't help your stress. It doesn't mean it won't help you in other ways. It doesn't mean it won't help a whole body systemic, lower inflammation, lifestyle change that can be of benefit. But we have to be realistic with ourselves about what we are doing, because I think there's a place for hope. That is important, but I think false hope is not a good thing. I think that can keep us trapped, for sure. Banking on, wishing that something is miraculously going to happen that has zero possibility of happening doesn't help propel us forward to actually living our life. With that, I will leave it here. So if you found this video helpful, please give it a like, leave your comments below, and just know that there's somebody here that definitely knows what you're going through, and I will talk to you guys soon.